can you hear me?
Yeah, we hear you, Prof.
Okay.
Yes, please, go ahead.
Yeah, so I'm going to start with my presentation. If you can confirm you can see the slides now.
Yes. Yeah, we see it. It's clear. Okay. Yes.
All right, so it's about the COVID-19 crisis in Italy, the management of the public health emergency. So, but before really going into details about how we're managing this crisis, I thought about giving a bit of a timeline of what has happened in the past few months. So, when in January 30, 2020, while the WHO was declaring that COVID-19 was a public health emergency of international concern, in Italy, it was also the day we started to close any direct connection between China and Italy. And also it was the day we implemented a series of other surveillance action we were monitoring. So the Ministry of Health decided to start monitoring big train stations and also airports. So perhaps we were focusing on somehow protecting the border while something was already happening inside the country and we didn't know. In fact, in less than a month, on February 21st, there was a bombshell in the country. So so they found out in a small town in the Lombardia region that 15 people were positive for COVID. And the big threat was that they were not able to find patient zero, so they didn't have any clue and don't really have now. They have no confirmation how this epidemic started in that specific area. But later on, very soon, they started trying to find other outbreaks, and it was in March the 8th that the country decided to close completely the Lombardia region. However, only one day after, there was the decree by the Prime Minister that decided that the whole Italy had to be considered as a red zone. So this action somehow replaced what was declared the day before. So there was the real country lockdown across the whole country. So all unessential activities were suspended or transferred to online. So there was a lot. So across the whole country, we started with smart working, and you could go out only if it was really necessary to go to grocery shopping or for health needs. And later on, there were other actions within the country that just reinforced this decree. And also across them, we also saw on the 11th of March that WHO declared this from epidemic to pandemic status. But this is just a small video that shows in just one month how the situation completely changed across the country. However, as you can see, even if the epidemic is well spread, still it's mostly focusing in the north of the country. And what has been really important is the surveillance system, which was implemented immediately across the country by the National Institute of Health. How did they do? Basically, not only collecting socio-demographic information about those confirmed to be positive, but also looking at their medical records. So therefore, they do publish a daily bulletin showing all the updates, and thanks to that we can somehow monitor the developments of the situation. For instance, you can see here that the country is all interested by the epidemic, but still outbreaks are mostly in the north of the country. But we also know that more than 70% of the affected are those that are 50 plus, and this also is about the fatality rate that profoundly, as we saw with the previous presentation, profoundly impacts the elderly. But we also say in line with other findings that it's the prevalence between men and women is different. So men are more likely to get infected. But also, what does the so this surveillance system? What does it's also to trace back from the confirmation of the diagnosis, also the onset of the symptoms, because we know there's a lag. And so, looking at the medical records, they try to continuously try to understand what is the when each person started to have symptoms, because this is very important for modeling. Because of course, if the person has already symptoms, is more likely to spread the infection, and therefore it's very important to understand what is the lag between the onset and the confirmation of diagnosis. And doing that, they are updating continuously the epidemic curve just to understand and try to model when the peak will be reached in the country. And for a subsample, so for instance, now in Italy, as of the 26th of March, we have more than 80,000 cases, so more than China. But for a subsample of them, like in this case, it's around a quarter of them, we have even more information. So the granularity is even greater, so we can understand what sort of symptoms are presented for each patient. So for the majority of them, it's just post-symptomatic or mild, but we know that about 25% have severe or critical symptoms, which is very important. But to better understand the problems we are facing in Italy, we have also to know a bit better how the organization of the country, which is quite peculiar. So Italy is quite small, but in terms of extension, but the area, but still it's high, densely populated. It's more than 60 million of people living in the country, which of course is a factor to take in consideration, because we know that the higher the density of population, the more likely that the virus would spread. But also it's one, life expectancy is very long. So in terms of the mean age, is among the oldest countries in Europe, together with Spain and France, and which is also another very important factor to take in consideration. But what is very important also to understand is that in the country we have 20 regions, and there is a very strong regionalism in Italy, which also affects how the healthcare is organized. So we have regional healthcare, therefore we have profound differences across countries, for instance, across regions, sorry. So for instance, we know that Lombardy region, which is strongly affected, is the secondary care is strongly developed, and not as much the primary care. On the other hand, another strongly affected region, such as Emilia-Romagna, has a very strong primary care as well. And this is very important also to put in place preventive measures. But there are also socioeconomic inequalities, and there's a north-south gradients, where in south normally they are worse off as compared to the north. But therefore, it is very important in the country, especially to monitor because we know that there's this big, massive outbreak, especially in the north, how the infection, so the epidemic is spreading. Therefore, we have been closely monitoring the epidemic curve at regional level. So, for instance, these are the 4 countries that have been mostly impacted by the epidemic. So I'm showing those that as of 26th of March have more than 5,000 confirmed cases. But as you can see, even among these 4 countries, Lombardia is the one which is profoundly impacted, with around 40,000 cases, while the others have a completely different slope in terms of the growth of the curve. And also, when you look at the other countries which have where the emergency is greater, so those that have at least 1,000 cases after, let's say, a month since the beginning of, so since we found out the epidemic, Even here, we can find there's a bit of a gradient. The farther from Lombardia region and that area in general, the smaller the number of confirmed cases. And so there are a lot of why. So there's a lot of unanswered questions about this. We keep asking why is this happening? Why was really that area? We know there's a lot of trading activities, factories are very much implemented in that area, and so there's a lot of also commercial activities and also trading with China, for instance, with Germany. One of the theory was about contact with Germany as well, but again, also there's weather is different across the country. With southern that is much warmer, but we know there's very weak evidence about weather. However, it might still be one of the weak factor contributing to that. And this is just to show again the two figures, but just to give you an idea. So it's the same scale, just to give an idea how different each region has been impacted by their condition. But also, what has been very important to monitor is considering the regional differences that we have in Italy. So, as a key indicator to monitor this public health emergency is the healthcare resource utilization, because while we know from one hand that the prevalence, the percentage of ICU, so um, ICU beds, which are among those are used for among those that the prevalence among the total of COVID cases. We also, and this is quite similar across the country, so the emerging care unit beds. And the longer the period, so for the longer the infection has been spreading, the more similar this proportion becomes across the regions. However, what is quite different, and this might also, we are starting to understand in terms of how the regional healthcare organization might also impact the spread of the disease, is, for instance, the prevalence of the percentage of those hospitalized across over the total. So, and for instance, if you look at the Veneto region and also the Lombardia region, which are two regions that are strongly affected by the epidemic, you can still see that despite the numbers in both cases being very high, the prevalence, the percentage of those hospitalized is very different. So this is another burning question that we're trying to understand and to assess, but also we are closely monitoring the healthcare utilization for this and also for, of course, other reasons. But also, because the tension in the country is very, very high, this is a typical case also that a very strong and important message might also be misinterpreted. So it was the 16th of March that the WHO tweeted, once again, our key message is test, test, test. And this was just a very simple, important message just to remind countries which had been diminishing the level of the problem, just to start taking actions such as identifying people that might have mild symptoms, just taking actions in order to contain the spread of the disease. However, in Italy, there was already a lot of controversy about whether we were testing enough, and so this just was like lighting up the fire even more. But so the question was, are we testing enough? Shall we test more? So if you look at this figure produced by our Wording Data, which is looking at data updated up to 20th of March, you can, so it's plotting a total COVID-19 tests versus total confirmed cases of COVID-19. And you can see, for instance, as compared with South Korea, which is a country that to a certain extent can be quite similar in terms of, for instance, age distribution to Italy, wealth, etc., etc. So they were testing more than in Italy, because you can see it's the dots is placed quite high, but towards the left of the graph. However, in Italy, they were testing still way more than other countries. So perhaps we were testing probably not as much, because we, in terms of our guidelines, we were testing those with symptoms. Others, for instance, South Korea, were tracing back all the chain of contacts, so regardless of any symptoms or not. And this might be important, but the real question was, shall we do more? Testing more might be a very effective measure when, at the very beginning of the outbreak, just to try to confine the interested area. At this point, at this phase of the spread of the epidemic, of the pandemic, at least in the country, it doesn't really make sense to test even more. And also, what we have to consider, looking at this very recently published article that's on JAMA, that sensitivity of the available tests that we're using at the moment might not be that great. So we know that to test people that might have the disease, we're using a combination of nasal swab and pharyngeal swab, and both have a far from perfect sensitivity. Of course, we're using them in a combination, and also we are repeating testing. Just to better try to identify those that might effectively have the disease. However, this is still far from perfect, and there's a lot in terms of the little overlap among tests, and this is also to take into consideration. Also, what is important, because it's something completely new that we have to learn from other countries. So, for instance, we learned a lot from China and perhaps Spain, which is also so where everything is starting now with even a greater pace.
Prof. Raffaele, you have
Yes?
only 2 minutes.
Okay. So what is important are the non-pharmaceutical intervention that might reduce the impact of the COVID-19, because we know there's still no effective therapy or there's no vaccine. So in Italy, as I said, in the 9th of March, we put in place a complete lockdown of the country. This has been used by many newspapers. As a picture, you can see the Colosseum, which is completely empty. You can't even go outside for a walk if you don't have a proper justification. And there was this study done by Professor Faxon and et al. And colleagues at Imperial College that were showing how non-pharmaceutical intervention can help reducing the impact of disease. And as you can see, this is plotting against the critical care beds occupied. And as you can see, no intervention is perfect, but a combination of them, as we're doing in Italy, might help a lot reducing the number of occupied intensive care unit beds. But also in terms of the healthcare reorganization, what we did were many things, such as we put in place an emergency line to support those needing. There was a reorganization of hospital beds, dedicated COVID areas just to avoid this to become a healthcare-associated infection, restructuring of abandoned hospital, construction of modular hospitals, increased national production of personal protective equipment, because we know there's a lack of that, also ventilators. Even fashion industry, they started to produce PPE, and also there was a socioeconomic support for those worse off, and because there was a complete shutdown of activities. So we provided financial support for companies and local business impacted by, we are providing financial support by the COVID-19 lockdown, social support for those worse off, smart working, teaching online. I myself am doing a lot of teaching online these days, but also home-based partial relief. Of course, this will create a crisis which is way greater than 2018 crisis. However, we know that it is essential and needed so far. But there's a lot of non-pharmaceutical intervention put in place so far. We know very little about the disease. So what we know for sure is that we have to stay home. These are the hashtags, the one used in Italy and the one used internationally, for instance. And also, I'm leaving you just with a few seconds of this very interesting video that shows was made by this Twitter user and also tweeted by the New York Times, showing all the governor and Italian mayor what they're doing. They even in a very peculiar way to try to avoid their citizens to stay away.
Thank you, Prof.
Yeah. You can finish it towards online, and thank you very much.
Thank you. Appreciate this. Actually,